Hi folks, I'm Dr. Challa, Krishnaveer, Abhishek. I welcome you all to the 20 course FDB. So today, our topic of discussion will be music therapy. Music as a therapy is very important. Understanding music in terms of health is of utmost desire. So, music has a timbre that is quality. The quality in music plays a major role more than quantity. So, when you hear a quality music, it appeals to all your sense organs. And then pitch. So, the pitch in music is also to be taken into consideration, because a person prefers a different pitch based on his mental condition, based on his age, based on his environment, based on the place he is in, based on his mood, right? So the pitch of the music, the choice changes, and intonation, pitch and intonation accord along with the stress marker. So music is a zigzag thing. It is like a signal which activates us. So that is about pitch. And then you have volume. So the volume of music is also taken into consideration here. So when you are far away, you have to increase the volume. When you're close by, you have to decrease the volume. When you're using earphones, it's very important that you maintain music volume up to optimal hertz so that it doesn't damage your ear system. So that is the difference between music and noise. So if it is not in optimal level, then music becomes noise, right? And then instruments and beats. So there are various instrumentals in music apart from lyrics. Music has lyrics. Lyrics is basically a poetic expression of verbatim, right? So apart from lyrics, music has a beat, it has drums, it has violin, it has guitar, it has piano, whatnot. It has all the instruments that you can imagine, right? All this together, they follow a beat, right? So instrumental music is of utmost desire, and it is very, very essential, because without instrumentals, I believe that music is incomplete. And then comes rhythm. So there is a specific rhythm in music. So if the rhythm is missed, then music becomes noise, right? So why is music connecting with us? The emotional connect between us and music is because of the rhythm, the timely rhythm, the perfect frequency that is being followed, right, at regular intervals. So it is because of that, music is able to connect to us, right? And then tempo. So tempo is the speed, is the pace of music. So if it is too fast, you won't understand the lyrics. If it is too slow, it will become boring. So you have to have a normal tempo. So the tempo again, it changes according to the situation, according to the preference, right? So these are the different aspects of music. So you have Western music, you have Carnatic music, you have Hindustani music, you have instrumental music, you have a lot of musics. You have folk traditional music, right? So our lives are incomplete without music. So we cannot exclude music from our daily life, right? So next slide. So usage of music. So the first use of music is community music, music as a community entity. So music helps in creating a social bond. So for example, in churches, in temples, in mosques, people attend sermons, people sing bhajans together, people chant together. So when you're singing together, then there is a social bond that is coming on between all of us, right? So a social bond is being created between or among people. So when you're singing together in a choir, you connect with everybody in the choir, you connect with all the members emotionally, culturally, you connect with everybody. So that is community music. So community music is based on, it can be a choir music, it can be a religion based, it can be a culture based, it can be a country based. When we're all singing our national anthem, Indians together we sing with pride. When we listen to our national anthem, it gives a lot of, it enthuses us, right? So, for example, the same Indian national anthem won't enthuse an American because we are emotionally connected to it. And also when we are singing in a group, when we are singing the national anthem in a group, right? You see the patriotic feeling in you, the rush of emotions, the adrenaline rush, the adrenaline push. You cannot compare it with anyone. So that's how you bond and socialize over music. And then music education. So music education is also very, very important because you have to be trained in music. So music education talks about getting trained in music, either vocal or instrumental. So you get trained in some sort of music or in some aspect of music or in some genre of music, and then after you get the training, you give performance, right? So getting trained in music, it may take 3 months, it may take 6 months, it may take 1 year, 2 years, 3 years, 5 years, 10 years. But once you're trained in music, you're ready to give performance, you're ready to give concerts. So that is music education. And then everyday use of music. So when you're traveling to your workplace via car, you switch on radio or you listen to MP3 player. So you listen to music to just pass the time over travel. When you're idle, you use social media, you use YouTube. When you open YouTube, there's music, right? There are a lot of music apps. So for example, you have Raga. You have a lot of apps, through which you're consuming music whenever you're idle or whenever, if you're working on your project, so that if you want your mind to stay focused, to stay activated, you want your mind to not become dull. So that's why whenever you're working or studying or doing some activity, you always put music headsets, and listen to music, which gives you a lot of concentration and which activates you, it energizes you, right? So it drives away all the lethargy, all the fatigue. So that is another advantage. And then music as a medicine. So basically, doctors use music as a medicine. So either the nurse or the medical staff, because doctors are not trained in music, they use pre-recorded tapes. So using these pre-recorded tapes, the doctors give music or put headsets to the patient who is recovering from an ailment, from an illness. So using the pre-recorded tapes, the doctors see to it that the healing process commences. So the patient is distressed because he is ailing from an illness, right? He is trying to recover or recuperate from a disease. So if he focuses on his problem, then it will be difficult for it to be solved. It will take a lot of time because not only physically but also mentally the patient has to be strong enough for him to recover completely or recover fastly. So that is the reason why the doctors use, or the nurses or the medical staff, they use pre-recorded tapes and they let the patients consume certain types of music based on their health condition, based on the disease. And then when they consume this, what happens is they forget all this tension, they forget all the stress. They have solace, they're calm, they have this soothing music which helps in healing. So we have seen over the years many cases, there are many case studies, many reports, many articles, many research where doctors are using music, pre-recorded musics. They're using them for patients for their better recovery. And then music therapy. So here, the music in music therapy, the person who is administering music, the person who is giving the music is actually a singer, a trained musician, or he's trained either as a vocalist or as an instrumentalist, right? So here in music therapy, the person is trained. So the trained music professional, he is performing before the patient. So he uses music as a therapeutic experience. So what the patient does is he consumes directly the live performance from the music therapist. So in order to be a music therapist, the person has to be trained in music and he has to be well equipped with many allied areas. That is, apart from music, he should be a good counselor, right? He should be a good listener, and then he should have good analysis. So all these criteria, all these elements are very important for a person to be a therapist, right? So let's go to the next slide and understand more about it. So what are the qualities of music? So music, basically, it is a tool to express, right? Your hidden fantasies, your desires. Sometimes it is very difficult to express in the form of prose. So it is always good, you can use poetic expression, that is music. So in music, you can embed a lot of secrets that you're unable to express through prose, right? So it is a tool of expression, music. And then empower. Music is actually used in various revolutionary movements, right? Various struggles, various freedom struggles, music has been used. So music is a tool to empower people. It's also a tool for literacy. So people are actually learning through music. We remember certain aspects through music. Even in chemistry, during our childhood, we used to remember the names of different elements through music, right? So music helps in empowering people in different ways. And then music is culture oriented and it gives a collective identity. As I've said, Indian national anthem, Indians connect to it. American national anthem, Americans connect to it. So for example, if I'm singing a Hindu bhajan, all the Hindus connect to it, right? If I'm singing a Christian song, all the Christians connect to it, right? So carols, the Christians connect to the carols. So for example, if I'm chanting a surah, all the Muslims connect to it. If I'm reading out from the Guru Granth Sahib, all the Sikhs connect to it. So it's a collective identity of different cultures, different traditions, different nations and different natures, right? So music is culture oriented. Folk people have their own music, right? And you have different segments of the society, different strata of the society having their own music. Tribal people have their own music. They have their distinctive style, their unique style, right? And then in music, there are various genres appealing to various emotions. Happiness, sadness, melancholy, frustration, disgust. So each emotion has different music, right? For example, you can express these emotions through music. Heartbreak, love, all these pleasures, everything can be expressed through music. So there are various genres and music is in different languages. So if you take instrumentals, If you instrumentals have no language, but when it comes to lyrics, when it comes to vocal, you have languages. You have different types of singing. You have throat singing, you have tongue singing, you have lip singing, you have mouth singing. You have different types of singing, right? And for some types of singing, you use all the parts of your mouth. So it is different. It is unique, and each song is in different language. You have songs in English, you have songs in French, you have songs in German, you have songs in Tamil, you have songs in Telugu, you have songs in Sanskrit, you have songs in Arabic. So you have songs in all the languages. Every language has their music, has their song, has their lyrics, right? And similarly, music is used in media as background score, right? And also, any film is incomplete without music. If there is just dialogue and the scene without music, then it doesn't appeal, right? You don't have that emotion. So, in order for a film, in order for any type of film to be complete, there has to be music. Soap operas are with music. The social media is filled with music, right? You cannot imagine your life without music, right? So music is place sensitive and situation sensitive. So when a person passed away, a different type of music is played. Okay, when a person is successful, a different type of music is played. When a person did something, a different type of music is played. When he achieved something, a different type of music is played. When he is in emotional distress, a different type of music is played. When he is in love with someone, a different type of music is played. When he is in a temple, a different type of music is played. When he is in a restaurant, a different type of music is played. When he is in a playground, a different type of music is played. When he is in a garden, a different type of music is played. So music is place sensitive and music is situation sensitive. It depends on the situation of the person and the place where the person is in. In temple, you don't play fast beats, right? You play soothing music because people are here to meditate and it helps in meditation. And then music actually gives the stimulus for well-being. Music is that stimuli that activates us and it moves us to our well-being. So health is the most important aspect. And I believe that music is restoring this aspect of health. So music is leading to well-being. Music is leading to peace. Music is leading to unity, to brotherhood, to sisterhood. So all these aspects are catered to through music. So music, whenever we are emotionally down, music is that one tool that is helping us come out and become strong versions of ourselves. It is energizing us, right? So music is a stimulus for well-being. And then music helps in building confidence. Whenever you're down, as I've said, if you're listening to motivational music, wow, you're confident now. You're ready to take on anyone because of the music, right? It gives cognition and also memory. Music actually improves your memory because of all the stress that is accumulated in your mind. You're unable to remember things, to retain things. So your memory is affected. Only through music, a stress-free environment is created in your mind, and you will be able to acquire anything, remember it forever, retain it forever, and your cognitive capabilities are perfect, will be perfect. Okay, so that is music for you. So music also develops a positive attitude. Music drives away all the negativity, right? All the pessimism in you, and only optimism and positivity will remain in you. You will become a very positive person with a good aura, attracting everybody around you, right? And music makes you a peaceful person. So music reminds different emotions. When you listen to certain music, you remember your past, You remember your time spent with your parents, with your loved ones, with your friends, with different people. You remember, music actually reminds you of different situations that you have been through in life. That is the impact that music can have on you, right? So, and also music makes us tap, music makes us dance. When you listen to music, you just can't stay idle, right? You just can't stay static. You have to be dynamic, you have to move your body. So full body learning happens only through music. And in the last slide, I want to talk about how music can be used as a therapy. So, as I have said, a music therapist has to be trained in music, in instrumental or vocal. And then he has to understand, he or she, if they want to become a music therapist, they have to understand the patient's current health status. For example, if a patient has BP problem, high BP or palpitations, a music with fast tempo, a music with high volume, a music with high pitch shouldn't be played because it will affect his health. So in order to reduce his BP, in order to reduce his pulse, a music with less tempo, slow tempo, low pitch, right? So all these aspects have to be incorporated in the music that is being administered, which focuses on the patient's holistic well-being. So understanding the patient's health is very, 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 very important. It's of utmost importance. Current health status of the patient. So you have to take into consideration the patient's current health and then administer music based on that. Optimal volume or reduce the volume. See to it that he's calm, he's soothing, right? There is solace around him. He's happy. Making him happy is the most important thing. Making him laugh, making him enjoy, right? And also you have to understand the patient's music preference. You cannot play a Japanese song or Japanese music to a person from Indian descent because he won't understand what the lyrics are. You can play an instrumental, Japanese instrumental, but if you are playing a vocal, Japanese vocal, the person won't be able to comprehend or understand. So see to it that you use the music that the person prefers that caters to the needs of his culture, his environment, his brought up, his education, right? His behavior. So you have to assess everything and then you have to administer the music based on that. And then the music therapist must always remember that music is not a substitute to medical treatment. It can never be an alternate to medical treatment. It just is a supplement, right? It cannot be a substitute. It can be a supplement. So taking medicine, allopathy, homeopathy, Ayurveda, whatever medicine, getting through the medical treatment, the operations, everything is important. And music actually helps the person recover from this treatment soon. But it is not an alternative to this treatment. Music is never an alternative, it only aids, it is just a supplement. Right? It is a supplement to foster healing, for faster healing. Right? So if you want the person to heal fast, to recover fast, use music. But music is not a substitute, an alternative to medicine. Remember that. And music helps in recuperating faster. It lessens the pain of the disease. A person is in pain because of cancer, because of another problem, because of so many health problems. He is in a lot of pain, mental agony, physiological pain. but music has the power to lessen the pain. It can reduce the pain, right? And music helps in restoring the rhythm and balance, because music is rhythmatic. Music has rhythm, so it helps in restoring the rhythm of our body. So breathing is a rhythm. Your heart rate is a rhythm. Your blood pressure is a rhythm. Your bowel movement is a rhythm. Your body clock is a rhythm. So whenever the rhythms of your body are disturbed, you're diseased. So music can play a major role in restoring the balance. Because of the imbalance of the rhythm of your body, you're ill. You're not well. So if music gets your body back to normal, gets the rhythm of your body back to normal, then you will be disease free. So remember, it is all rhythm that is actually curing you. Even the medicine is trying to restore back your rhythm. Even your swallowing is your rhythm. Swallowing is a rhythm. Breathing is a rhythm. Everything is a rhythm. If the rhythm is affected, then you're diseased, then you're ill. So illness is imbalance of rhythm. So if the rhythm is restored, then your illness is kept at bay. Okay? And as I've already said, music relaxes you. Music soothes you. And most importantly, music is a bio, psycho, socio-linguistic approach. Bio, psycho, it's because of biology. There is biology in it because it works on the biology of your body. And psycho, because it works on the psychology of your mind. Socio, it is because it connects you to the society. And linguistic, because there is verbatim and non-verbatim in music. So all these aspects together makes music a bio, psycho, socio-linguistic approach. And I believe that through this approach, we all will be disease-free. We all will overpower all that is plaguing us. All these pandemics, epidemics, all these health problems, health hazards. We'll overcome everything. And we'll all be united. We'll all be happy. We'll all be prosperous through music. Thank you.